This is WFYI News Now. It's October 8th, and I'm Abriana Herron. On today's show, the Vision Zero Task Force aims to lower traffic incident rates in Indianapolis. Indiana candidates for U.S. Senate will hit the debate stage later this month. Hurricane Helene damaged the U.S.'s largest IV fluid manufacturing plant, causing hospitals to brace for the shortage. And will COVID-19 be seasonal like the flu?
They typically are going to crest in about 8 to 12 weeks, take another 8 weeks or so to diminish, and then be gone for somewhere around another 8 to 12 weeks before the next one occurs.
Those stories are coming up. But first, city officials are grappling with the fallout from sexual misconduct allegations inside the Hogsett administration. WFYI's Jill Sheridan reports a new investigation committee questioned failures in the system at its first meeting last week.
A committee to investigate sexual harassment allegations was approved by the Indianapolis City County Council last month. The move comes after 3 women accused Mayor Joe Hogsett's former chief of staff, Thomas Cook, of sexual harassment. The city's HR director, Tawana Ellis, answered questions about procedure and policy related to reporting harassment. She acknowledges the system is imperfect.
I think that's why we're here today, is that we've had individuals in our workplace that have just not reported it.
More people have come forward in recent weeks to report incidents. The city has also announced a new reporting tool from a third-party company where employees can report anonymously. I'm Jill Sheridan.
August marked one of the highest rates in traffic incidents in Indianapolis in recent years. September wasn't too far behind. WFYI's Samantha Horton reports the Vision Zero Task Force aims to reduce those numbers.
The task force is composed of city officials and organization leaders from AARP, Health by Design, Recreational Cycling Community, and Indianapolis Public Schools. City County Councilor John Barth is the chairman of the task force. He said in a news release that the group, quote, represents a unified effort to address critical safety concerns and create a city where no one has to fear a fatal or life-altering accident on our streets. The City County Council passed the Vision Zero proposal in August to find ways to improve safety for pedestrians, cyclists, and drivers. The task force's first meeting later this month will identify actionable steps to reduce traffic incidents. I'm Samantha Horton.
The nonpartisan Indiana Debate Commission announced Friday it will host a debate in Indiana's U.S. Senate race later this month, even as one of the candidates won't participate. Only Democrat Valerie McCrae and Libertarian Andrew Horning will take part in the debate on October 29th. Republican Jim Banks declined the commission's invitation. The Senate race is an open one, as incumbent Republican Mike Braun opted to run for governor this fall. The commission is inviting people to submit questions for the debate on its website, indianadebatecommission.com. Those questions, which will be vetted by the commission, can be submitted by October 17th. Hospitals are bracing for a shortage of IV fluids. That's after Hurricane Helene damaged the U.S.'s largest IV fluid manufacturing plant in North Carolina. SideFX Public Media's Farah Usuri reports the impact is felt in Indiana.
Baxter International is the largest manufacturer of IV fluids nationwide. The company told hospitals across the country that they will only get 40% of their IV fluid orders. This has pushed hospitals to implement conservation plans. Dr. Ryan Stone is the chief medical officer at Schneck Medical Center in Seymour, Indiana. He says they are currently switching patients to oral hydration as soon as possible and using different sizes of IV fluid bags to reduce waste.
And so if we want to try to conserve, now's the time to do that before we get into a scarcity standpoint.
Stone says the shortage has not yet affected patient care in his hospital. Baxter and federal agencies are working to bring the plant up and running as soon as possible, but it's unclear when that may be possible. The FDA says it may look to temporarily allow imported IV fluids. I'm Farah Usuri.
And for our final story today, will COVID-19 be seasonal like the flu? A listener inspired this question. Indiana Public Broadcasting's Abigail Ruman reports one expert says he expects there to be 2 different distinct seasons.
While both viruses can spread year-round, there tend to be higher levels of infections at certain times. The most recent wave of COVID infections started in late August, which is much earlier than the flu. Dr. Scott Steinecker is the medical director for infection prevention at Parkview Health Systems. He says COVID seems to follow a wave-like pattern.
They typically are going to crest in about 8 to 12 weeks, take another 8 weeks or so to diminish, and then be gone for somewhere around another 8 to 12 weeks before the next one occurs.
Steinecker says he expects to see another wave during late spring. He also says paying attention when cases begin to increase can be useful for planning when to get a booster shot. For Indiana Public Broadcasting, I'm Abigail Ruman.
That's all for today's episode of WFYI News Now. Today's podcast was produced by Zach Bundy and Drew Daudelin, with support from the news team at WFYI and public media journalists across the state. Our news director is Sarah Neal-Estes. Kendall Antron produced our music, and I'm your host, Abriana Herron. If you like today's episode, remember to subscribe and share, and follow WFYI on Instagram, TikTok, Facebook, and YouTube to check in on our newsroom throughout the day. Thanks for listening. We'll be back tomorrow.